delighted to share this brief presentation with my friend and colleague, Dr. Justine Bukenya. And we will talk about an effort that we have done together as part of the ARISE. We refer to it as ARISE Doctoral Training. So I'll provide a brief background on what the effort is, and Justine will come and take us through some of the key recommendations. We'll be cognizant of time. So the background to this really is a sense that there is a lot more that can be done to enhance public health on the continent. The Africa CDC has issued a call for a new public health order on the continent to be sort of better able to withstand challenges like COVID, other sort of pandemics that might be coming, but also the existing challenges that we have. And two of the key efforts that they have advocated for is strengthening public health institutions and strengthening the public health workforce. That was really the premise for us to advance, that we can work as members of academic institutions that focus on public health and research and policy institutions on the continent to come together to address this call to action from Africa CDC. There is an observation that a lot more is happening among medical schools. Within public health, there is a lot of emphasis on the master's level. And the idea from this enterprise was to focus a little bit on leadership training, so training the next generation of leaders through doctoral programs. The effort really has been pursued as a survey. A number of key leaders from each of the ARISE sites came together and generated a survey that was distributed to all schools of public health around the continent, Sub-Saharan Africa and North Africa. And the model that we have advanced really is to get an understanding of how doctoral training in Africa in public health is at the moment, to find where it stands, where the gaps are, and where it could go, what the recommendations for strengthening it is or are. And there were three elements of the conceptual model that we have pursued. One, to understand what are the instructional elements of doctoral program. How are doctoral programs set up in schools of public health in Africa? What are the focus areas on methods? What aspects of substantive areas of knowledge has been pursued? Typically, we find that there is a lot of interest in maternal and child health and nutrition, but we found that there is a little bit of less interest and less attention to mental health or non-communicable diseases or injuries. So that was an aspect that we were keen to understand. Also on the instructional elements, what are the cross-cutting elements that might be useful to pay attention to, and how schools of public health are advancing? Questions around leadership, communication, and so on. A second aspect was sort of a description of the institutional side of things. How are schools of public health in Africa able to perform what is supposed of them, given the faculty that they have, given the student body and financial resources that they have, given the IT infrastructure that they have, and what learning environment exists in those schools as a basis for us to understand where to go next. And a third element of the model that we have paid attention to is around the external environment, elements that are external to the School of Public Health. One of them is how schools of public health can relate to each other within country and within the region and within the continent and possibly in relation to the world at large. So networks that are important to leverage each other's strengths. A second aspect was questioning the value of interprofessional education, or examining how schools of public health relate to other domains that are important for health, in veterinary or in agriculture or in education. So where does the School of Public Health position itself to other professions, to medicine, to nursing? A third element was understanding questions around the relationship between the educational system, our universities, and the research organization in a country, and the Ministry of Health and the national CDC in that country. How can we sort of bring together a closer unity between these elements of the ecosystem? And these are aspects that Justine will go into. So without further ado, let me pass it on to Justine Bukenya, colleague, friend from Makerere School of Public Health, to take us through the recommendations. Thank you so much.
Yes, thank you very much, Prof. Wafaie, for walking us through what we did and what were the key findings. Based on the findings, this morning I'm going to share with you the 6 overarching recommendations. On this slide, we summarize the recommendation, but in the subsequent slides, I will be able to dive in the details what speaks to each recommendation. Briefly, the first recommendation emphasizes strengthening competence-based education and standardizing accreditation across the continent. Then the second one is about strengthening information technology in terms of infrastructure within our universities. The third is about financing. Nothing much can be done if we don't have funds. Then Prof. Wafaie mentioned the issue of interprofessional education, and also we need to strengthen the linkage between academia, the practitioners, and the research institutions. Lastly, we need to keep on monitoring, evaluating our achievements, and also to showcase the good practices. So speaking to the first recommendation, where we need to strengthen the competence-based education, it is really important to adopt transformative learning approaches. If at all we are to create leaders or products that are able to synthesize information from multiple domains as part of interdisciplinary teams. So people need to be well-grounded, and they're able to synthesize information coming from different sources, and at the end of the day, they make grounded decision. To do this, we shall also need to have robust means of assessing our programs, as well as having standard ways of accrediting these programs across the continent. To be able to do this, it's very important for the country to have ownership, the political will. We, the individuals, have to be at the driving seat. If at all we are to align the findings from research with the country needs. It's not fair to have products that are not really helping us to solve our own problems. So to be able to do this, we are proposing that this Association of School of Public Health in Africa will play a vital role in coordinating us. Though some people think this could be a little far, why can't we start maybe at regional level? We agree as countries from East Africa, this is how we can coordinate ourselves better. Then other regions can do that. Then the Association of School of Public Health can be at the top. So the second recommendation is about strengthening technology infrastructure. We need both hardware and software. To be able to have robust technology infrastructure, we need to have access to computer labs. We need to have where we are storing our data, not only having storing capacity, but also the ability to process this information. A lot of research is going on, but it's stored on people's laptops, not accessible to users. So this is an area we need to improve on moving forward. Another area is to go digital. There is no shortcut about that. We need to create and have access to digital learning content. We saw what happened during COVID. At the end of the day, each and every university had to move into this direction. But again, we are not yet there. We need to do a little more. But at least COVID proved to us that it is possible to go digital. There is also need to have substantive investment into digital technology. We know what's happening and we know what is really needed. So we need to have a lot of more investment to improve e-learning and have access to information technology. In a continent, where we have most of the households with no access to computers and internet, e-learning and mobile learning, I think, is the way to increase access to pre-service and in-service education. The third is about financing. There's no way we can improve our infrastructure if we don't have adequate funding. From our findings, we found that both the trainers and the trainees had modest access to funds. So we need to have a lot of funds. We need to think through how are we going to get this funding. And more importantly, if we have the country buy-in and we are able to get funds that are from local sources, maybe we shall be able to align our needs better than having external funding. I'm not saying that we should not get external funding, but we also have to be in it and contribute as people who are likely to benefit more from this. Why do we need these financial resources? Both the trainers and trainees will need money for training. We need money if we are to have leave, sabbatical leave, to go and write our work out. We need money for mentorship programs, and we also need money if our trainees are to attend the international training programs. So all this calls for political buy-in. All our countries, we need political engagement at national level to begin with, then we go regional and global, to make sure that we get solutions that speak to our regional health challenges. The issue of interprofessional education cannot be emphasized anymore, considering what we are experiencing in terms of pandemic and climate change challenges. No single discipline can sit down and say comfortably we can address the pandemics. We need people with different trainings, with different skills to come together if we are to get ready for pandemics and also to solve climate change challenges. So to focus on interprofessional education, we need to have an environment where learners will sit together, and if they are able to sit together, they will be able later on to work together in interdisciplinary manner. Not saying this one is inferior, this one knows more, this one is more important. I think we need to have all these skills together if we are to fight pandemics and climate change challenges, for example, on our continent. So institutions interested in incorporating interprofessional education training, they need to review the existing curricula, and they also need to interest the trainees, including even the trainers, to get grounded into this interprofessional education training. Again, bringing people together will require funds, so we need to look for funds. As we move forward, we need to foster the value of One Health within our countries and also regional as we go global. So we cannot continue working in silos as academia. We need to get connected to academics, then the practitioners and researchers. We need to move together. What does this schema tell us? That all of us are at the same level, but they are symbiotic relation. This is a symbiotic relationship. It's a win-win situation. The health system needs us as academicians to provide them with the information. The education system also needs the health system. We can get experts coming from the health system to come and talk to us. Now we are talking about policy. How can we develop policies that speak to our needs? So we have to be always speaking to one another. And also the research system has to go to the health system and find out problems that we need to work on. And after getting our findings, we need to share them so that at the end of the day, we are able to get to conduct research that speaks to our own problems, and we are able to implement our research findings. Many times we have policies that are not speaking to us. Many policies that where we are not involved. But if all of us, the three systems come together, we shall be able to solve this. Last but not least is the issue of keeping track of where we are and also sharing good practices. So as we keep on monitoring and evaluating what we are doing, we shall be able to improve. If, for example, our work was at this level, if we analyze objectively, we shall be able to see our weakness and strength, then we move forward to the next step. As schools, we invite all schools of public health within a country to begin with. Can we come together and compare notes and then share experiences? We have in all of our countries where we are coming from, we have universities that are really strong and those which still need help. But if we have these associations or meetings or gatherings where we can sit together as schools of public health, we will be able to help one another. This may call for harmonizing the doctoral program between institutions so that what is taught in different institutions within the country speaks to what is being taught to another university. And if, for example, we have exchange of students, it will be easy to harmonize the accreditation. As we move on, improving on working together, coming together, getting connected, we need to look at the existing infrastructure within, for example, the Association of School of Public Health in Africa, and also engage with other association of schools and programs that speak to public health within our continent. So we need to keep on disseminating what we've got. The knowledge generated has to be shared with all members. As we move forward, we've had the Association of School of Public Health for long, but it needs our support. This is our association. Can we be more active? Can we strengthen our association as an umbrella association for schools that provide public health on the continent? Sorry. Yeah, this paper was published in May 2024. In case members are interested in getting to know how, in details, how the data was collected, the major findings and recommendations, we invite you to read this paper. But above all, we thank all members from the ARISE team and the other institutions that came together to conduct this study. We are very, very grateful, and we call upon all members that having schools of public health to disseminate this effort as we think through what we can do better to improve doctoral training on the continent. So what we are planning to do is basically to think through, these are the findings, what do they mean to us as people from Africa? So we need to keep on interpreting these results, then we share the recommendations and also think through how we are going to implement these recommendations. So we are going to continue involving all the countries that were involved, but even those countries that were not involved, kindly feel free to contribute to the future of this work. So as we move forward as a ARISE, we shall also benchmark what is happening from other consortia like African Economic Research Consortium and also the Consortium for Advanced Research Training in Africa that has really helped especially women to attain PhDs on the continent. I think they've sponsored over 100 PhDs so far. 100 students have graduated from here. So we shall keep on benchmarking. So training program, this is really a program with long-term goals, and this will require to revise our curriculum and also set a number of training and research activities. We are proposing that for a start, can we start focusing on pandemics? We look at climate change as well as adolescent health. I think that could be our focus, but we will welcome ideas if we feel that there are other areas we can handle. So this will require providing integrated training and capacity building as to foster interprofessional education. We need to equip trainees with the tools to address complex global health priorities, and also advance capacity of each country that is involved, so that we get leaders that can help improve the public health situation in our respective countries. I thank you all.